landmark study published in the UK finds that the benefits of widespread pandemic lockdowns amounted to, quote, a drop in the bucket compared to the cost. Now, researchers say draconian measures taken in the spring of 2020 had, quote, negligible impact on COVID mortality compared with lighter touched countries. That's according to the Telegraph's review of this study. Now, scientists at Johns Hopkins and Lund University conducted a meta-analysis of almost 20,000 studies on the effectiveness of lockdown measures and found that in England and Wales, lockdown saved as few as 1,700 lives in all. By comparison, the region saw around 11,000 COVID deaths per week at the pandemic's height.
This comes just as new peer-reviewed commentary in the Journal of the Canadian Academy of Child and Adolescent Psychiatry argues that studies highlighting the harms of school closures on kids and teens' mental health have been overblown and overemphasized. So
let's talk about the first. Go ahead.
Sure, go ahead.
Well, let's just talk about the first one first, and we'll get to that. So interestingly, so they're not saying that like mitigation efforts didn't work at all, but what they're saying is when comparing the UK to Sweden, with Sweden there was less like government imposed mitigation efforts, but people took precautions anyway. Many people stayed home. They didn't need to be forced into it by the government. What they're saying is that the government doing it didn't add a lot of good beyond what people reasonably decided to do on their own. And I think that, so some people might say, well, that's an academic difference, but I think it is an important difference because, you know, giving the government, if we can trust people generally, broadly, not everyone, but to do the right thing, that's better than the government forcing you because the government having that power could misuse it in some future catastrophe, could claim more power for itself, could force you to do things that are totally unnecessary at different times. Again, I always bring up the TSA example, how awful plane travel is and totally divorced from any safety rationale whatsoever. So we don't want to just give the government more power willy-nilly. And if this shows that it was not an added benefit, really, that is a powerful argument for not allowing those things.
Right. That's a useful clarification because it's not saying that the mitigation measures don't work. No. It's saying that some countries were able to incentivize people to take those mitigation measures, or because of a higher sense of social cohesion or whatever it is, they were more willing to just do it to protect their fellow citizens than we have been in America, which goes along with something I've been saying throughout, which is that I do wish there had been more carrots than sticks. So much of this conversation about COVID mitigation measures has been, are you for or against? Very little about how to incentivize people to actually behave correctly or behave in a way that's in line with the public health benefit. Mm-hmm. And as much as there's been so much criticism of China and lockdowns, et cetera, one aspect of it that it gets under-discussed is the ways in which it was made easier for people to stay home, having grocery deliveries, not being concerned about risk of employment, risk of losing insurance. Those kinds of things in certain countries can make it a lot easier for people to be compliant than they have been in the United States of America, where we decided to instead kind of offer some fake superficial valor for essential workers while offering them very little in the way of being able to protect themselves. Now,
I think that's true in some of our European peer countries. I'm sure it's true in some cases in China, although, I mean, there was also a lot of reporting on people stranded in various parts of China during outbreaks or like unable to get out because it was so stringent and so at gunpoint that sometimes stranded without food or without supplies and away from family because the lockdown would descend on an area arbitrarily.
I'm not the PR rep for China. The point is that there are clearly interventions that various countries, including China, took that if implemented in the United States of America, a country with enormous resources, could have made persuading people to stay home a better option than mandating, certain kind of mandates. People were never mandated to stay in their house, but mandating that they get vaccinated to go into certain kinds of spaces and things like that. So the second part of this study is also, the second part of our read, rather, is interesting because it's a study that analyzed the effects of school closures being one of the negative aspects of the shutdowns that had like a longer term negative effect on the education and mental health of children. And so if there hypothetically were shutdowns, but they didn't save that many lives, which we can quibble with. If they didn't save that many lives, but also didn't cause that much harm, then I would argue that it's a wash. The more significant the harms that the lockdowns caused, the more we have to interrogate whether they were a good idea, right? So this study says there was actually much more of a mixed bag in terms of the mental health outcomes from kids, and that there should be more scrutiny looking into why some kids stayed the same or fared better, whereas other kids fared worse. And it looked at some of the reporting on this and the reporting of parents about their kids' condition. And what they saw were many parents that would say things that were rather conclusory, like, my kid's mental health is worse. But when you ask them to actually analyze what is their depression metric, what is the incidence of them expressing some kind of suicidal ideation, when you actually try to get them to quantify and compare to how they are now versus how they were before the pandemic, they actually, what they write down, what they tick in the box, is that there was almost no change and sometimes an improvement. And so it's pushing back at the media framing. It's just accepting parental statements and the statements of some organizations that just say lockdowns were bad for kids, when it's just a much more nuanced story than that.
Right. I'm having a little bit. I'd have to look more closely at how they reach these conclusions, what exactly populations of children they were surveying, because I know it's the case that teen self-reported mental health rates and suicide attempts among girls have been getting worse over time. Before the pandemic, they were already in that trajectory. So I have not seen a single study to suggest an improvement during the pandemic. So maybe this study is suggesting it is continuing to get worse along the exact same axis you would have expected.
Suicide incidence is different than generalized depression rates. One of the authors points out that it is really hard to study suicides in children due to frequency. Suicidal thinking is much more common. So we're looking out for it as a symptom of COVID/post-infection COVID. So they're saying, it's easier to measure people's expression of suicidal thinking given the frankly rarity of actual suicide attempts or people who do actually kill themselves. So, this is not, and the authors of the study are very clear. They're not saying this wasn't a problem. They're not saying there weren't poor health outcomes for kids. What they're saying is that when you look at populations and you're looking for something other than an overarching message, you see some populations that fared better than others. It's worth understanding why, because they're going to have a more nuanced health intervention the next time this comes around, if it does in fact require some kind of shutdowns. Just saying because there were harms to kids, we should never do something like this going forward, is the kind of lack of nuance that could get us in a situation where we have the Black Plague killing a third of the population, but because we haven't really weighed the pros and cons in a more nuanced way, we're having bad policy outcomes in the other direction. Well,
and also the school lockdown situation for kids was wildly different based on where you were, what kind of school you were involved in, what your level of economic comfort is.
This was a Canadian study, I believe. But certainly in the United States, state by state, there were very huge differences.
Right. I've said on the show before, I have a million nieces and nephews. They're mostly in private school. They had the exact same educational experience throughout almost the entire that they had prior to the pandemic. Their schools didn't close. People who were affluent, if you could, if we're talking about like improvement, if you pulled your kid out of a okay school and you had a lot of money and put them in a little pod with 3 other kids and had the parents taking turns tutoring them, that it would not be crazy to think that was more individualized attention and education that might have actually been improvement.
Or if your kid were getting bullied at any kind of school and no longer had to go and then face their bullies, then that would also be an improvement. But I think you're focusing a little bit too much on the idea of it being improvement. I don't think they're making some huge claims that many kids had mental health improvement. They're saying that in some cases, just like if you just pulled any random group of people, they're going to be happier this year than last year. The other half are going to be happier next year than this year.
I just pulled up this New York Times article from February of this year, February this year. Nearly 3 in 5 teenage girls felt persistent sadness in 2021, double the rate of boys. 1 in 3 girls seriously considered attempting suicide. So there, again, it was already on this path before the pandemic, but I think we're still trying to grapple with how it was affected by COVID.
Yeah, look, we did just do a segment about how concern about the children is weaponized to try to restrict speech on internet platforms. And I think that everyone should be cognizant of the fact that kids are also being focused on in the context of pandemic-related closures to advance an agenda that you may or may not agree with, a policy perspective that you may or may not agree with, but I think that we should be able to make decisions about separate and apart from the heightened emotionality that comes with focusing on children in particular.
Sure. What I object to it in the former case, though, is they're weaponizing it in order to take freedoms away from the kids and from everyone else. That's why I'm so outraged by it. Which in this case, it's not. It's a taking away. The people taking away the freedom, the going to school, are on the same side.
Well, one other point is worth noting is that there was also a recent study that showed that Boston Children's Hospital researchers found that 70% of households with COVID-19 infections had that infection originate with a child. So, there are these relative competing freedoms. The lockdown, the COVID, the school shutdowns didn't happen in a vacuum. There's a lot of conversations about it that say, well, kids aren't dying from this anyway. Why are we doing the shutdowns? Remember, the issue was that the children were going to be vectors. So that parents who are home from work, that policy is being undermined if they are getting exposure from their kids going into a pool with all the other kids that have been home with all their other parents every day and coming home and bringing it into the household. So it's just from a public policy perspective, if you do believe on some level that you had to have these shutdowns, or if there were these shutdowns on a professional basis for adults, then not similarly protecting adults by not having the exposure to their kids, and also the teachers in the school not having the option to opt out because they're teachers in the school, does create a high risk of infection despite lockdowns in other areas of life. That was the concern. Whether or not you think the benefits of those outweighed the harms, that's an open question that some of these studies are trying to get to. But it wasn't just about the fact that kids are less likely to die, so why are we shutting down schools?
We got to go. More Rising right after this.